Hi, Dr. Liz here with Conversations for Effective Living. Today I'm covering symptoms of postnatal depression and anxiety. So postpartum depression and anxiety, PMD is what we also refer to it as, perinatal mood disorder. So these are the big things. Like if you're feeling totally overwhelmed, weepy, anxious, or nervous, angry, like really angry, scared by your thoughts, like you're not yourself, guilt, regret, shame, if these are coming up and really affecting you on a day-to-day basis and you're like 2 to 4 weeks out from the birth, then we suggest you get some help. Okay, PMD specialists around the world suggest you get some help, meaning you join a support group for postpartum depression or anxiety, or you see a therapist that's a specialist in the area. Okay, those are the big things. Certainly if you feel like harming yourself or harming the baby, again, that's very, very rare, so I don't want to scare anyone about this. But if those are coming up for you, those are signs to get some help, no matter how far out you are, right? So a lot of PMD hits right around 6 to 9 months. You see a bump. 5 months even, you see a bump. Often when women go back to work, you see a bump. So get some help, because it's PMD in that whole first year. So if you're having symptoms, please, you're vulnerable and it's so treatable. I mean, the women get better in my practice within 1 to 2 months. It's so fast. Okay, so what are some other ones? Certainly if you're crying all the time, depressed mood, tearful all the time. Let's see. Extreme fatigue or loss of energy. Okay, so you just want to sleep all the time to the point where you don't even want to get up and talk and attend to the baby. Like that's a sign. Sorry, I'm getting these up here so I don't miss any for you. Appetite and weight changes. Either a drop in your appetite or you're overeating all the time. Like those are signs combined with the others. I think that really needs some attention and some help. Difficulty sleeping, even when the baby's sleeping. So a lot of people forget to talk about the anxious part of PMD. And if you're having racing thoughts, obsessive thoughts, you can't sleep, you haven't slept for days, it feels like, those are warning signs for PMD, and you definitely need to get some help there, okay? Because sleeplessness affects all kinds of stuff. So go see a specialist around that, all right? Feelings of worthlessness or guilt, like you're a bad mom, that's a warning sign. Irritable, angry, nervous, we talked about that some. Lack of interest in the baby or lack of feelings toward the baby. Like this just looks like a little alien to you. Like that's a sign that you need to get some help, okay? And that can get better. I think I talk about that in another video. You don't have to feel that way all the time. And when you're in a therapist's office, you don't have to hide it. So I know out in the world, you feel like you have to hide that, because I've been there. So you feel like you have to tell everybody you love the baby so much, and you do, okay? You love the baby. This is separate from that. You're just having trouble accessing those feelings, and a therapist is going to be able to help you do that. All right? It's not a normal feeling. I mean, bonding grows over time. Again, I have another video about that, so check out the pregnancy and postpartum playlist. But quickly, I'm going to say that grows over time, but moms have some feelings. So if you're just feeling completely numb, that's a sign to get help. Okay, those are the symptoms, some signs of PMD. This is Maternal Mental Health Awareness Week, so I wanted to put this up this week to get the word out about it, right? I'm going to put up a graphic too about how you can find help in your area and how to reach out for help, okay? You can always see more on those websites. You can always see more on my website too, drliz.com, and get a free hypnosis for better pregnancy or to reduce fear and anxiety or to feel more emotionally stable. All of this can help you during your pregnancy and after. All right? Okay, have a wonderful week.